It's my opinion that non-vascular edema is also present in nerves in the bone. Nerves and blood supply, we know that blood vessels and nerves travel together. And in the bone, we have blood supply and innervation in the periosteum, and in the medulla and cortex of the bone as well. I feel that non-vascular edema can affect the bones in such conditions as shin splints or perhaps where the tendon attaches to the bone if you have extensor tendinopathy in the elbow, like a tennis elbow, say. Maybe some of the problems in the periosteum of the bone. And I feel we can stretch these nerves in the bone, just as we stretch the nerves in other procedures, such that we can get rid of the non-vascular edema so the pressure goes down and the blood flows in there. And let's pretend this lady, let's say this lady has a case like shin splints that are there all the time. Perhaps the problem with the shin splints is that there's not enough blood getting to the nerves in the periosteum around the shin. So we'll say that she has a sore shin here. So I'm attempting to bend the bone. Now we know the bones don't bend. Well, they don't bend like an elbow or they won't bend like a tendon, but they do flex somewhat. Maybe that small amount of flexion is enough to stretch the periosteum, and maybe that's enough to get the stretch the viscoelastic nerve so the fluid flows out. You can bend this knee. Of course, periosteum is around all the bones. There's your shin. You may have to put, if the knee is too flexible, the knee's a little bit sore, you may have to put a bolster behind the knee. Is your knee okay when I do this? Now, if I'm pulling up on the leg here, I'm pulling up, that's bending the shin bone. Tibia is bending. Now, if she has pain on the inside of the tibia, the medial side, I might want to pull the leg laterally a little bit at the same time. Internally rotate your foot and then laterally. Now the stretch is more on the inside. Do you feel that on the inside? If I want to get the stretch on the outside, external rotation, and now I'm pulling somewhat medially enough. Feel your tibia bending? Pressure on, pressure off. Pressure on, always monitor the response with the patient. So I'm not normally looking at the camera. I'm looking at the patient's eyes. Pressure on, pressure off.